This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of helpful tips to avoiding falls, how the multidisciplinary clinic helps you navigate the pathway, an introduction to the pre-admission clinic, and the necessary items and equipment a patient may need.
Some general tips for your home to prevent falls would include getting rid of any clutter or any loose mats or rugs or anything else that might cause a trip or a fall. If you drop something, you're not able to bend down and pick it up as you did before, whether you had a hip or a knee surgery. You're going to have an alternative way of getting that item off the floor. It could be something important like the phone or your keys. So you're going to need your reacher. It's good to have night lights through your house. Make sure that you leave some lights on so that you're not moving around in the dark. Have a hand railing on your stairs, whether they're indoors or out. You want to have a hand railing. It's a lot safer. Use a cordless phone or a cell phone. It's a lot safer, and that way if the phone is ringing, you're not going to be rushing off to try to get that phone that's attached to the wall. You can go to a private company and you can get a call system that you would wear as a wristband or a necklace. Use the emergency call system if you have one available in your house or in your apartment complex. Also, to prevent falls, you might want to put a chair in your laundry room so that you can sit down while you do the laundry. You should bring your reacher in there as well. You could use the reacher to get down into the washer or dryer so that you don't have to do a bend or a twist. Have your coach look around your house as well and see if they have any suggestions on how it could be made safer.
The multidisciplinary clinic is really a great system. You're seeing your doctor, you're seeing the surgeon, you're seeing physiotherapists, occupational therapists, nurses. You're getting the whole gamut of healthcare professionals providing you with the best care you can get.
Through the multidisciplinary clinic, the patient is also aware of what we're going to do every day, so it's not a whole new thing. With the multidisciplinary clinic and the patients becoming more involved and knowing what's going to happen while they're in the hospital, we've been able to alleviate some of that anxiety, but we've also been able to standardize care for nursing.
An ADL suite is activities of daily living. So this is a room where we have a kitchen set up, a functional kitchen set up with a bedroom and a bathroom. So when I meet individuals in the multidisciplinary clinic, I can actually take them into the bathroom and we can practice using the tub transfer seat and the raised toilet seat. At least they can start using it before surgery so that it's in place by the time surgery comes around.
In the pre-admission clinic, with your assessment, we ask you specific questions. So for example, we'll be asking you about your home environment. Do you have to be able to get up and down stairs? Will there be somebody there to help you?
Within the few weeks before the surgery, they would come to the pre-admission clinic, and there they would be seen by anesthesia and have x-rays and blood tests and ECG. And they might be seen by an internal medicine doctor if they have other medical concerns to make sure that they're optimized for the surgery.
How long will my stay be in the hospital?
You can be in for 3 to 5 days. They do try to get you out in 4.5 days.
Through the hip and knee pathway, basically what we developed was a standardized process for every patient, so that we have a day 0, which is the day you have surgery, day 1, day 2, day 3, and day 4 you should be discharged.
The care plan is, in the booklet, it's a pictorial representation of each day of your stay in the hospital, and it is used as a guideline to make sure that patients are aware of what is going to be happening on a day-to-day basis, and it's to make sure that the staff are progressing the patients in a timely fashion. So when you look at the care plan, you will see that on day 0, that is the surgical day. So on that day, mostly it will be bed rest, The nurses will start you with circulation exercises. Occasionally, they may be helped to get up and go to the bathroom.
Normally on day one, we would start with physio. So ahead of time, that would be explained to them in the multidisciplinary clinic, what physio is going to do with them that day, sort of what the goals are.
That first day after surgery, we'll also get you sitting up on the edge of the bed, and possibly if you're feeling fine, we may well help you to stand, and you'll start taking a few steps using a walking aid. Checking to make sure that all of the equipment that you require for when you go home is in place, and they will start talking about discharge plans. We'll also start the exercises. So the second day is very much the similar plan. You'll continue with the exercises and mobility. The nurses will be helping you to sit up for meals, get up and go to the bathroom. By the third day, some people by that day will be ready to go home. They'll be practicing the stairs if it's required. Again, continue with the exercises, and they'll be making sure that they have everything in place for when they go home. And then day 4 to 5 is basically a continuation, planning for that discharge home.
You know, we definitely have patient input into their pain control. Are we controlling your pain? Are we not controlling your pain? And we modify as we need to, right? And not every patient handles anesthetic well. So of course, if a patient is very nauseated and having issues, you know, maybe physio isn't going to work with them that morning. So yeah, we do have to modify things.
So for individuals that are having the elective hip or knee surgeries, there is going to be some equipment that we as a team would recommend. So the first piece of equipment is a tub transfer seat. So it has 2 legs in the tub, 2 legs outside the tub. The legs are adjustable, so you can adjust the different heights. This is called a raised toilet seat. For individuals that are having some difficulties getting off a toilet, a lot of times getting off a higher surface is easier. So this just goes onto the toilet, and then make sure that it's screwed on for safety reasons. So when you get on and off the toilet, it just gives you a little bit of height. If you have a removable shower head, you can take that off the wall and get your back and your hair. Some bathrooms do have grab bars in place. These are something that you can actually purchase and put in yourself, but they can just aid in helping you get in and out of the tub. The other piece of equipment is a long-handled reacher, and this is a wonderful piece of equipment that I recommend to everybody. And it can aid in getting dressed and along with other activities in the house. So if you drop something on the floor, you can use your long-handled reacher to pick it up. You're not going to be able to put full weight onto that surgical leg, so we will order you a walker. So first off, you would start with a standard walker, so that's all 4 legs, and eventually progress up to a 2-wheeled walker with a brake kit.
You need to remember a good pair of walking shoes, loose-fitting clothing such as walking shorts, your toothbrush and toothpaste, your dentures, eyeglasses and hearing aids, a hairbrush, an electric razor if you're a man, and a walker without wheels.